Hello, and thank you for joining us for this very important conversation about how the federal dollars from the American Rescue Plan can be used to advance and improve the lives of children in Texas and locally. Today, we have four esteemed panelists who is going to each talk about their area of expertise and hopefully provide us with direction about not only where the state of Texas and how things are going across the nation, but as well as locally, and how dollars and commitments from our policymakers will be used to advance the health and well-being of our children. So the bios of each of our speakers, you should have seen those in the invitation, so I won't spend very long introducing our panelists, but we have Rob Gromwald from the Federal Reserve, and we have Art Rolnick from the University of Minneapolis or Minnesota, and we have Council Member Carla Cisneros, and then the new Director of Education for our Mayor, Olivera Jankowska. So if you'll welcome my panelists, we'll start out with Mr. Gromwald giving us an overview of ARPA.
Great, thank you. I'm going to share my screen. And so you should see a large American Rescue Plan funding for childcare slide on the first slide there. Great, well, it's an important time to talk about childcare with the new funding that is coming in from the federal government through the American Rescue Plan. And what I'll do today is give a little background about the Federal Reserve and how we're involved in this issue, about the childcare sector overall. And then I will describe what is in the ARP money and how the Office of Child Care has provided guidance on how that money could be spent. So to begin with, today my comments are my own, not those of the Federal Reserve Bank of Minneapolis or the Federal Reserve System. And this is a picture of the map of the Federal Reserve System. It comprises of 12 regional banks and the Board of Governors in Washington, D.C. The Fed's primary responsibility is regulating the flow of money to promote stable prices and maximum employment. In addition, the Federal Reserve supervises numerous banking organizations and provides a variety of payment services to financial institutions in the U.S. government. Texas is served by the Federal Reserve Bank of Dallas, which has branch offices in Houston, El Paso, and San Antonio. Headquarters are in Dallas. So the Federal Reserve's outreach and research work in early care and education is now housed in the Fed's community development function, which promotes the economic resilience of low and moderate income individuals and communities. The Federal Reserve Bank of Dallas is very much involved in this work. Dallas Fed President Rob Kaplan has been a proponent of early childhood education. And at the Houston branch of the Dallas Fed, Anna Crockett is a community development analyst, and earlier this year published an article, Hard-Hit Childcare Industry May Need Multi-Sector Response to Revive and Thrive. So the overall work in early childhood development began at the Minneapolis Fed. And so Art Rolnick is here. He was our director of research back in 2003. And he and I published a paper called Early Childhood Development, Economic Development with a High Public Return. We note that within early care and education, that the child care is a substantial portion of that sector. Other parts refer to programs such as Head Start and public and private preschools. And the quality of these settings affect child development, school readiness, and a number of outcomes in school, such as grade retention and performance, but also into adulthood, including employment, earnings, and crime. So that we are able to look at 3 long-term studies that follow children over decades that were able to establish a high return on investment. Those include the Perry Preschool Project in Michigan, providing preschool for 3- and 4-year-olds, the Abbotsford Educational and Child Care Program in Chapel Hill, North Carolina. And this study looked at full day, full year, essentially a highly enriched child care setting, starting at just a few months of age until kindergarten. And the Chicago Child Center Project in Chicago provides 2 years of preschool. So these are all ratios that are well over 1. So there's a return on there's a return on investment. And while children and families benefit, the majority of benefits to these projects accrue to the public. And note that these large returns come from targeting resources to disadvantaged children, such as those growing up in families with low income. There's also emphasis on the availability of childcare and the effect that that has on parental employment and productivity. There are a series of studies that were conducted at the state level that primarily are based on asking parents about the impact of childcare availability and reliability on their ability to enter the workforce and remain productive at their jobs. And several of these studies show that childcare has a sizable effect on parental employment and productivity, which also translates to effect to businesses. If they have employees that are leaving, they have to costs in terms of turnover and recruitment costs. There also could be reduced productivity if childcare arrangements are falling through the cracks during the day and parents have to deal with childcare issues. We also note in this research that childcare issues disproportionately affect low-income families and their ability to enter the labor force and find work. Now, the childcare model itself has a number of challenges, and I'm going to talk a little bit about the challenges during the pandemic. But childcare, despite producing a number of substantial societal benefits, faces issues such as parents with young children that are their primary customers are often early in their earning careers. They often can't afford to pay higher tuition rates. Childcare is a labor-intensive model, and providers can't reduce staff without compromising safety or the quality of the program. Government-funded subsidies for low and moderate income families often fall short of covering the costs of providing early care and education. And providers themselves often come to the sector with a background in education or child development and don't have experience with the best practices for operating the businesses. And indeed, most childcare operations are small businesses. So then comes the pandemic. Once COVID-19 arrived, there were a number of challenges and additional financial challenges for childcare providers as they needed to modify practices in order to address COVID safety and health-related concerns. So for example, child drop-off and pickup practices were more labor-intensive, and staff are required to perform daily health checks on children. Other costs include hiring substitute teachers or closing classrooms for a couple weeks following COVID exposure, which can be very disruptive. Some providers making alterations to their facilities to accommodate social distancing, and also access to basic cleaning supplies and personal protective equipment. And one of the large costs was operating with smaller group sizes to promote a safe environment. So officials early on recognized that these costs were a challenge to providers, but they also noted the importance of the sector. Early on in the pandemic, essential workers were not able to get to their jobs in healthcare, in frontline workers, in police, in emergency care, without access to childcare. So those parents who had young children needed childcare in order to go to work. This awareness has led to a sizable interest in finding ways to support the sector during and after the pandemic. So the ARPA funds, the American Rescue Plan, include $24 billion for child care stabilization funds, and those will be available until September 30th, 2023. And in addition, $15 billion through the Child Care and Development Fund, called Supplemental Discretionary Funds. It's a long title there. That's part of the Child Care and Development Block Grant. This was preceded back in March. $3.5 billion was passed in the CARES Act, and $10 billion was passed this past December through what's called CRSA, the Coronavirus Response and Relief Supplemental Appropriations Act. So altogether, there's been over $50 billion that's been available to the sector. Early on in the pandemic, this was actually about the estimate that economists looked at to think about what that sector actually needed. So we're going to focus more on this more recent money that's come to availability through the ARP funds. We note that due to time limits, the spending on these child care funds, the administrators are going to need to balance strategic shorter-term investments along with their base funds to support stabilization and recovery more immediately, but also think about the future and the sustainability of childcare, especially high-quality childcare, and especially for low-income families. There's a lot of flexibility in these various grants, and how the money is laid out really provides states a number of options and how they're going to spend this money and how they can spend the money. And what I'll do is walk us through a few of the information here on some more specifics. So first, just under the heading of maintaining and increasing the supply of high quality childcare, and particularly in underserved areas and for families with low incomes. So both across the stabilization grants and also through the Child Care and Development Block Grant, that there is resources to offset the pandemic costs. For example, the stabilization funds through subgrants can be structured to pay for all of the costs that I mentioned before for past expenses or toward prospective expenses that we may continue to see over the next few months. Now, parts of the stabilization funds, a small portion, 10% of the money, can be used to support the supply, and such as developing a construction and renovation financing program, or providing low interest or forgivable loans and grants for startups and expansions that can leverage private sector investments. And this can be used particularly in underserved areas, such as those in rural areas or tribal communities and communities of color. Along with such financial assistance, within that 10% of administrative funds is the option to be able to provide business technical assistance. As I mentioned before, childcare providers don't come to the industry with a large background in business, and so technical assistance can support them and how they could put this money best to use. Next, developing programs, in areas with low license supply by establishing connections with and providing licensure pathways with financial incentives for those providers that are non-licensed. Excuse me for a second. Next, recognizing that different business models within childcare have different expenses, having differential support for those that provide infant and toddler capacity, which is a higher expense for providers to provide, and also those that support non-standard work hours. And then finally, developing ways to make provider payments more consistent. For example, when the pandemic started, childcare providers were allowed to base their subsidy reimbursements based on the enrollment or capacity of a program instead of just the attendance. So more typically before the pandemic, fluctuations in attendance could vary the types of money that a provider would receive. Next, under the heading of boosting low-income parents' ability to work and increasing the continuity of care for children. So this is basically a heading in which you are able to reduce the amount of money that parents have to pay alongside their subsidy through co-payments, to increase reimbursement rates to providers so that it better matches the true cost of providing a high-quality program, increasing income eligibility thresholds so more children would be eligible, and smoothing the benefits cliffs so that we don't come to a hard edge and children lose their childcare subsidy just with a small increase in family income. Also, there's a lot of flexibility in terms of allowing parents to do other activities other than work. And what Art will talk about is actually decoupling the funding from these work requirements and using them, and what he'll talk about is the Minnesota Early Learning Scholarship Model. Stabilizing the childcare workforce and supporting program quality. And during the pandemic, the emphasis on program quality seemed to be lost from the discussion. Instead, we emphasized more of the access of childcare for families so they parents can go back to work. But quality is very important to support child development so children arrive at school prepared to succeed. This is where we will achieve those long-term benefits. So looking at ways to improve and increase worker compensation through higher wages, providing benefits or paying bonuses, and also supporting teacher training, curriculum, and practice-based professional development, such as coaching. And then looking at other ways to use these short-term financial resources in order to produce long-term benefits, such as offering shared services for providers, especially for family-based home providers, and strengthening data systems that oversee the childcare sector and can use to identify where there is need for supply and where there are openings in childcare. And then finally, developing ways to look at how other parts of ARPA may apply to childcare. So for example, states generally are going to receive large sums of money through their state and local fiscal recovery funds, which can also be applied to childcare. They can be used broadly, or they can offer premium pay to essential workers, which would include childcare providers. Since childcare providers are small businesses, they can qualify for some of the resources for small businesses, such as the State Small Business Credit Initiative, which is in ARPA. Then ARPA also is fostering ways that the public sector can work with philanthropy and also with the corporate sector to align resources for childcare. So this provides you a long list. A state would not want to do all of these things, but instead choose and select options that work well together in a comprehensive strategy. And from a city perspective, you can see all of the flexibility in how you might work together with the state in order to channel these resources into your local community in a way that'll have the best result. So with that, I will turn it back over to Keonta.
Thank you so much, Rom. I think probably the audience is wondering, because I certainly was, is there anything prohibitive? Because it seems like this is pretty broad and can really be used as, to meet any needs that a community or state might, recognize or decide to tackle. So are there any things that folks can't do as it relates to investing in childcare?
So I think that there's constraint more on the amounts versus than the can. I think if you had a way that you're looking to use the resources for a particular project or support either on the supply side or access or improving program quality, there'd be a way to do that. But within the stabilization funds, most of that money is designed to go into subgrants to providers. So 90% is designed to go to providers. 10% can be used by the state for administration, but also for some other purposes. So there is the amounts that you could use would depend on where it falls within those buckets. In terms of the guidance of what's coming through the Child Care and Development Block Grant, the guidance that I was reading shows examples of where you could use a lot of different flexibility in those resources. A lot more flexibility than what you would typically see in guidance from a year-to-year basis on using the CCDF funds.
Yeah, that's great. Art, it sounds like,
and I will disclaim, as a Federal Reserve, these are my own views, but just to understand, the Federal Reserve is separate from the federal government. So these are my comments and my views only on reading the guidance and talking with those in the field. To get the true story, you're going to have to talk to the Office of Child Care at the Administration for Children and Families.
Yes, thank you for that clarification, Rob. We really appreciate it. And we appreciate your insights. I know for myself and talking with local nonprofits and other policymakers, this has kind of been an opaque box as far as exactly what the parameters are and where are the restrictions. So we appreciate the overview from your expert opinion and not that of the Federal Reserve. So Art, I'm going to switch to you because you have a ton of experience with leveraging dollars that are available in order to do some pretty not only innovative but evidence-based and then cost-effective strategies and programs around early childhood development. This is probably the most money the child care sector has ever seen available. And so can you talk a little bit about, for our audience and for our policymakers, even on the panel, how should we be thinking about how to use these dollars, and what are other states across the country doing?
Well, thank you, Keonta, for this opportunity to talk about what I'm going to argue is the best way, the most effective way to invest the incredible amount of resources that are coming to this industry. I want to make the first point that this has been shown to be one of the best, if not the best, public investment we can make by investing in high quality early childhood education for our most vulnerable children. Yields a very high return, and most of it is a public return. The child, of course, does better, the family does better, but there's huge benefits to the public as we reduce most of our kids when they go through a high quality early childhood program that's parent focused. They don't need special ed, they're not retained in a grade, teacher turnover goes down. And when Rob and I looked at this research back in 2003, we found a very high return, but since 2003, the new research says we underestimated it. We now have data on adults that were children in these high quality programs, and they're healthier. They're more successful in life generally as adults. We now have data on children of the children, and they're more likely to graduate high school and graduate and go to college. So we're seeing an awful lot of benefits. And if anything, Rob and I underestimated the return. It is really a strong return. But the question, and the question you're raising, is what's the best way to invest in this way? And I'm going to argue that the research and the science points us in the direction, four major components of a successful program. First, target. We've mentioned this a number of times. These high returns are to our most vulnerable kids, because if children start school well behind, on average, they do not catch up. And there are huge costs to the child, to the family, and to society. So once you get into middle class and above, the returns are very small. So with limited dollars, they should be targeted, at least at first, to our most at-risk children. So targeted. Parent-focused. Parents are a critical component of the success for these children. And learning starts at birth. All this neuroscience research on brain development says critical components of the brain are developed by age 3. We can't wait till 4 and 5 to start these programs, to get the parents involved and engaged and empowered. So we're talking target, we're talking parents. It's got to be quality programs. And I've already mentioned the fourth thing, and that is learning starts at 0. So with these components of a high quality program, then we'll get the kind of results actually we're starting to get in various communities around the country. We have advised starting with early learning scholarships. Now, why do we want scholarships? Well, first of all, we can target them clearly to our most at-risk kids. That's relatively easy to do with a scholarship. It empowers the parent. It gets the parents involved, and we start with the parents at age 0. So parent empowerment and engagement is a critical component, and scholarships move strongly in that direction. Quality, our scholarships have to be used at a high-rated program. In Minnesota, we have a rating system, most states do, and it's a 4-star rating system, and our scholarships can only be used at 3 4-star rated programs. So this way, when we know we're giving a family a scholarship for their child, we know we're going to get the kind of results because we know we're going into quality. And as I said, start at 0. Our scholarships start at 0. So we have the components that we think science tells us will make a very effective program. And it's a fairly simple idea. It's not complicated. We're essentially using the power of the parent and the market. So every dollar in scholarship ends up in a provider's hands. We give our parents a letter, congratulations, your child has the scholarship. And they choose the program that works for them. It could be family-based, it could be center-based, it could be language immersion, it could be Head Start, it could be public school. What works for that parent is critical here. What's convenient, what works for that parent, as long as it's 3 4 star. So the scholarships allow you to improve the market, to help fund the market, to help fund providers, but it doesn't go to the providers and empower the providers directly. It goes to the parent, and we empower the parent. As we know, one size doesn't fit all. We need a variety of programs out there that fit the needs of the parent and the child. And that's critical. So we can move this along in a very simple way by providing scholarships to parents and having a rating system. So we call this the Minnesota model because we've actually gone beyond, this is theory. We're up to $70 million a year. We're serving about 15,000 children now in Minnesota, our most at-risk children that are in foster care, children that have incarcerated parents, children from homeless families, children living in poverty. We've really targeted it well, and we're getting extraordinary results. We're finding our kids, historically, they may be 30% school ready or less than that in some communities. Kids that are through our program are now 70, 80, 90% school ready. Our parents, they're going back to school, they're going back to work, we're changing their lives. And it's so interesting. This was true in North Carolina that had a high quality pre-K program with some of their poverty schools. They're finding no achievement gap by grade 3. And teacher turnover goes way down because now the teachers can teach. They don't have to deal with so many problems when kids come in behind. So there's all these extra benefits that, again, I said, the newest research says we're underestimating the benefits. And we have a very straightforward way of dealing with the market. We're letting sort of the market develop on its own. The market's very powerful. Once providers see that they can get scholarship families that are paying, say, up to $10,000 a year, there's a big incentive to increase quality. There's a big incentive to pay more, and there's a big incentive to expand. And that's what we're finding in Minnesota, that we now have 2,000 high quality rated programs in Minnesota. 15 years ago, we had virtually zero, and many of these are in our most at-risk areas. So it's so interesting. A lot of the programs are developed in poverty areas. They never had economic development like this. And so there's all these wonderful impacts by empowering the parents through this program. And there's very little, sort of from the ground up, so you don't have to micromanage this industry. You have to empower the parents. So I would argue that the best way to use this federal funding, and it's very flexible, fortunately, and I've talked to the Department of Education people, and they are very much on board that we can use this federal money, states and cities can use this federal money directly for scholarships, because again, every dollar will go to a provider, it's targeted, it's quality, and we have about a dozen communities now that are doing scholarship models that are getting the results. So we're now showing it actually works. This is not just theory anymore. It works, and I would argue it's working better than we thought. There are some unintended consequences. One of them was our parents are doing better and they're going back to work. There are unintended consequences. Teacher turnover goes down. We've gotten an awful lot of great feedback from the parents and what it means to them when they get a letter saying their child got a scholarship. And we do testimonies with our parents, and we asked one of our parents, why did you think your child your 3-year-old got a scholarship? And she says, well, because she's so smart. My point on this is we have to understand that learning begins at birth. The parents are a critical component, and by empowering the parents with a scholarship, we can get the kind of outcome that science says we can. We don't have to live in this country with achievement gaps. We talk about equity, we talk about inequality. This is one of the best tools that we have that we know that works, that indeed will reduce intergenerational poverty and will reduce inequality. So that's what I have been promoting around the country. And like I said, we've had success in 12 different areas. And basically the work that Rob and I did helped to give the evidence. And now we have the actual outcomes to show it works.
Wow, Art, that's amazing. I have read some of the data from your reports, and it's really amazing that a simple sort of redirection and use of dollars could make such a significant impact. One of the challenges I've, talked about your model and talked about, I even included it in the mayor's task force on equity recommendations about how Houston could really implement this strategy in order to help, close our gaps. You may or may not know, just a few years ago, our school district was under review and threat of being taken over by the state because we had so many schools that were failing. And so, it's a major problem, the gaps in Houston. One of the challenges or pushback that I received in talking about your model is, what is the significance of that language around scholarship? Because Texas already has a quality rating system. It already pays providers, more based on their star rating. It already tries to encourage parents to choose, higher rating facilities. But it seems like parents, aren't that interested and really are mostly thinking about, location. Is it convenient on my way to work? So can you speak to the significance and how the language and maybe even the strategy really is an important distinction from, what I described that we already have?
Well, you can have a rating system, but what the scholarship does, when a parent gets a scholarship, we list the programs in her community. It could be his community, her community, that are 3-4 star rated, that they can choose with the scholarship. And the scholarship, is a full ride scholarship, so they have a big incentive to use it. And every one of our parents use it. And it doesn't matter whether they're in the rural areas or when in the cities. It can be a neighbor down the block, and the neighbor down the block has a big incentive to become a 4-star rated program because these scholarships pay so much. So we've had no trouble in our parents, even though they want convenience. Well, many of them can get convenience because the neighbor down the block wants that scholarship. It has to pay well. It can't be a $3,000 scholarship. It's got to at least cover the costs. And for our rural areas, when it's up to $10,000 and they get 6 at a family-based program, they get 6 children, they can do very well financially. So you can make this a very viable financial market. You've got to be generous with the scholarships. If you try to go on the cheap, it's not going to work. But if you're generous with the scholarship, the other thing I like about the scholarships, you can do it in the small. We have cities that do this. We have small neighborhoods that do this on their own with private funding, and they provide scholarships. But it's easy to bring to scale. That's what we're in the process of doing here in Minnesota. We're serving 20% of our vulnerable kids. We're not going to stop till we get to 100%. This is not hard to bring to scale. You don't need a big government infrastructure here to bring this to scale because you're using the market. But I would say our experience is it's not good enough just to have a rating system. You need incentives, and the incentive here is that scholarship. And like I said, every one of our scholarships has been used by when our parents apply and get it, and it's a fairly simple process. Everyone uses it, and they give us feedback on how it changed their lives, and they're recognized. And well, of course, once they're in a quality program, some of our parents say, okay, great quality in pre-K. Am I going to have the kind of quality in kindergarten and first grade and second grade? And I say, this is kind of victory. I've got parents that engaged that they want to have the same kind of quality in K through 6 or whatever. So I'm going to say our evidence suggests that we had that concern when we first started. Would the parents use the scholarships? Would there be programs for them? Well, as soon as the market found out, our first pilot, we gave out about 400 scholarships. Once the market found out that there were 400 families with scholarships, Montessori expanded their program, faith-based expanded their programs, and they started recruiting the parents. And the parents had these choices, and it empowered them. So I'm not saying there's some startup issues, there are, but our experience, and I think this is true in Denver, this is true in Richmond, Virginia, and other cities, this works.
That's amazing. Thank you so much, Art. I'm going to then switch now to one of our policymakers here. We have Council Member Cisneros. And I'd like to ask you, after hearing and reflecting on this, and I know, I've known Council Member Cisneros for, quite a long time now, and I know that she has a passion for early childhood, but, what is really a city's role in getting involved in supporting, children's development? Why should cities even care or be interested about the things that we're talking about today?
Well, thank you, Dr. Moore. This is the exact question that led me to run for city council. As a public school third grade teacher, I saw firsthand that the city was supporting neighborhoods around some schools and not so much neighborhoods around other schools. And I could see the impact that it had on children. The responsibility for the well-being and success of children doesn't just belong to their families or their schools. The responsibility really belongs to all of us. Each of us as individuals or as organizations or different levels of government, we all have a role. And it's not the same role. What a city can do is different than from what other entities like a school district can do. And cities have known that they have a responsibility for children, but it's often limited to efforts made through parks or libraries in the health department, or maybe the police department if they're trying to stem crime. But there's so much more that is possible. Focusing intentionally on developmental assets, supporting things like quality childcare, valuing youth. Youth as resources, opportunities to be of service to others, safety, creative activities, opportunities for youth programs, meaningful connections to out of home programs, early literacy, cultural competence. Those are all things that cities can help encourage. The pandemic has helped shine a light on long time existing disparities between neighborhoods that have kept many children from growing up to be successful adults. And as a nation, we have not done a good job of turning our economic strength into social progress. It's really discouraging to see that our worldwide rankings regarding education, quality of life, upward mobility, competitiveness have all fallen. The United States cannot achieve its potential when so many Americans are falling short of theirs. Just last week, Jerome Powell, the chair of the Federal Reserve, said these things are holding us back. So yes, cities have a huge role. City government is local and is close to the people. And I just can't tell you how excited I am about this conversation and about the opportunities that are possible through the American Rescue Plan that will enable investment in infrastructure and systems that support healthy child development.
Thank you so much, Council Member. And I'm wondering, because I know that you've been committed to this work and have been in this space for a while. Do you have some specific ideas about, how these ARPA should be used and what we can do here locally in Houston?
Well, most of the money, from what I understand, is going to the state and to the counties. So, being good partners with those those entities is important. And I think that it's also important, really, first of all, there's got to be good leadership at the top that recognizes the importance of ensuring the success of children and that we understand the connection between the success of a child and the future success of a city. And I think, we definitely have that in our mayor here. He when he came on board, he's started the Mayor's Office of Education, which hadn't existed before. He allowed me to start a council committee on childhood and youth, which we didn't have before. So, I'm encouraged, very much encouraged by that. Departments cannot operate in silos. They must collaborate. And I think it's important to to be intentional about what our goals are. It's not good enough to back into the goals and say, we have a Parks and Rec Center, so yeah, we're doing that. I mean, I think it's, we have to look at the goals themselves and then design actions around them in very intentional ways. And then to be, reflective, really what are the city's priorities? How have investments been made, and which ones do we need, and which ones are most impactful? What is the return on specific investments? There's already a lot happening in that K-12 space, but we're missing some. That early childhood, there has not been nearly as enough conversation about that. Is this the right distribution of city resources? How is effectiveness measured and reported? I think that there's a lot more that we can do. I've been having conversations, with City of Houston department directors, obvious ones like the Mayor's Office of Education, libraries, parks, health, about what we can do to be more inclusive of children, but also HPD, and the housing department, and BARC, and the city's IT department, government affairs, economic development. Those are really very productive arguments or conversations. It really has not been arguments. People are very supportive, actually. But when you start saying, so what more can we do? There's a conversation that's happening right now that I'm very excited about in the housing department. Is looking at, is there a way that when we have the 9% affordable housing tax credits, is there a way to award extra points to a developer who's going to include on-site childcare facilities? And so they're talking about that, but I think it's really all come out of this heightened awareness that we have right now, and the additional opportunity we have.
Thank you so much. So we're going to shift, and just for the audience, we already have some questions coming in. So feel free to drop your questions in the Q&A section, and we're going to answer those briefly. But I want to shift now to Olivera, and you have recently joined the mayor's office as a director of education. And reflecting on what we've talked about thus far, and what you have done. I know that you're relatively new to the role, so I won't put you on the hot seat. But can you tell me a little bit about how you think your office can be most beneficial in using these federal dollars to close these equity gaps and advance the health and well-being in our city?
Much for this opportunity. Even though I'm new in the mayor's office, I actually come from the child rights sector. I've worked for UNICEF for the past 6 years, and really my entire life, I've been always dedicated to education and access. I'm a living proof that education works. I come from an impoverished family that really education was the key for me to become who I am today and to be able to give back to my community. So with prefacing that, I think, there's a lot of things that are great opportunities for us to shift that change in societies today. I'd like to start us off with a little quote that I pulled from Michael Bartlett, the National League of Cities, who are a generous partner of ours at the Mayor's Office of Education. But he said something like this: city leaders can leverage investments in the American Rescue Plan Act to make smart investments that not only meet the holistic needs of students in their communities, but also set them on the road to long-term workforce and economic success. And I truly agree with Michael, because this is not just about meeting the needs of the students at this point. We are talking about a long-term economic success. My office does a lot of work in terms of education, and oftentimes I have to clarify that my office doesn't really necessarily focus only on schools. And the easiest way to describe that is we focus on capital E education, everything education, not small e education schools. So given that, we focus on coordination, communication, and collaboration. And because of that role, I believe we have a strong influence on how this ARPA funds can be administered. We coordinate with local superintendents, with school principals, with stakeholders, and we help inform them on strategies to meet the needs of the underserved students in our communities. We also communicate. We are really good about understanding what are the school's needs and how these can be met. We are keeping open lines of communication, and that helps us connect with school districts and helps us connect with educational institutions and get those resources to the people where they need the most. And finally, our most important pillar is collaboration. Through the City of Houston's Mayor's Office of Education, we have a formal role in how the funds are administered. We don't have a way to say how those will be spent. However, we have a critical role as an educator, as a influencer, as a collaborator with education partners. So I think there's a lot of aspects that my office can be beneficial in the conversation with the ARPA funds and how we can be supportive of everyone else. But I think the most important is definitely the ability of us to influence a big group of people to come together and help understand what are the most impactful ways these funds can deliver society's progress.
Thank you. Thank you so much. So we have a couple of questions from the audience. So I'm going to jump right in there. And this first question, I think, is probably directed towards Rob and Art because it's asking about Minnesota. It says, are you braiding the CCDBG subsidy funds in Minnesota for the scholarships, or are scholarships funded from a different government funding stream?
Look, a very good question. We do braid it. Maybe you could call it a different funding scheme because there is 70 million earmarked for scholarships. But if a parent has gotten child care assistance, we will take that into account and add enough so that we fully cover the cost with the scholarship of the program. So we do braid them. And so the child care, the problem with the child care money is that parents aren't required to spend that money on quality care. They don't have to go to a quality rated program. And also not all that money goes to 0 to 5. And they don't generally reach the most at-risk foster children, for example. So we're trying to move as much money as we can directly to scholarships. But the answer to the question is yes, we do grade that. And it's true with Head Start too. If they go to Head Start, we will add a certain amount based on what Head Start gets per pupil. And we want to make sure we at least cover the costs of these programs with the scholarship.
Thank you. The next question is, what is the nature of the political opposition to expanding early childhood development programs? And I think that could go to a council member or Oliveira if you've experienced any political opposition, or really anyone on the panel if you've been trying to advance early childhood but have faced some political challenges.
Well, I will say I haven't talked to anyone who said that this is a bad idea. I mean, really, truly, every single person at every single level that I've talked to seems to understand it's a very good idea. And I guess the only negative thing is, how do we do it? Who pays for it? What's the funding stream? That's the most negative part of it at all. Is just that, how do we get there? And it's not always clear how we get there. There's a lot of red tape, with some existing funding streams, that are like embedded in the government, the federal government, that's not completely aligned. I mean, there's early child care dollars right now that's like in public ed and in Department of Agriculture and in health, and I'm not even sure where else, but I think there's labor. There's some in labor, but it's being able to aggregate them and navigate the red tape is hard. And so we're trying to understand that better so we can, beyond this wonderful influx, with the ARPA dollars, how do we navigate a system, that's not really easily navigable or something, easy to navigate, and easy to say.
Yeah, let me jump in here. I won't say there's opposition anymore. There used to be some because there was some notion there's fade out effect, and these good results we get from the first grade don't continue to the third grade. Well, James Heckman, Nobel laureate, has responded to that, and yeah, there's some fade out effect, but generally speaking, especially emotional IQ, outcomes in terms of long-term success, in terms of crime rate going down, in terms of children of the children, I've mentioned this. We're showing that the fade out effect is easy to respond to, in the sense that we still get a very, very strong high return. I think the problem is that, yeah, there's a lot of people that say this is a good idea, okay? But when it comes down to the money, when it comes down to the funding, you're competing with all kinds of other things that sound very good or politically have a lot of strength. For example, in Minnesota over the last 15 years, we spent over $1 billion building sports stadiums. And over this time, while we've had some success recently, over most of the time, virtually nothing for early childhood, even though there was a lot of agreement. And the problem is these kids don't, our vulnerable kids and their family, they don't vote. They don't have the political clout. And so even though, so my view of this, you've got to go out and market this. You've got to lobby for it. You've got to get, this is economic development, by the way. These are the future workforces. So you got to get the business community on your page and make the case. This is a good investment, and we can't afford not to invest in these children. And I think that despite words, you've got to lobby and you've got to get down into the nitty gritty there on the funding to make sure that we don't get pushed to the back burner. It's easy to push this issue to the back burner and say we've got more important things or politically important things. In my view, there's nothing more important than these kids.
All right, I think thank you for raising that point, because also, when I sat on the mayor's task force, about 4 or 5 years ago, we did hear that. It's like, where's the money for this? And there's a paucity of resources for this space. But it seems like, based on even what I've heard today, that excuse really can't be used anymore, because now you have dollars that are earmarked for this. And so now it's really like, there's no more excuses. We need a plan of action. These dollars are coming down the pipeline, and we need leaders who are then going to have a plan. And Art, you have presented a really, I have investigated it. I've talked to everyone. So, who's participated, in your program from an administrative perspective. So, it sounds like, this really is a viable path forward, and we just need people who are able and willing to do that. So I'm going to turn it over to Olivera, who has an additional comment.
Yes, and just wanted to add on to that the Houston is particularly advantageous to this comment that it's the right time for us to act, because my office is the leader of the Child-Friendly Cities Initiative from UNICEF, and it's really a framework for what Dr. Rolnick was explaining, that we need to have this youth participation. We need to have this ability for children to be part of the decision-making process. And really the CFCI, the Child-Friendly Cities Initiative that we are leading, is dedicated specifically to that. So we have the framework of how to develop, how to include children into this process, how to make sure that it's for children, from children, but also that we have, obviously the funding. So it is, just wanted to point that out, that it's never been better, especially for Houston, being the only first city in the United States, signing an MOU to seek this designation from UNICEF. So that's just a truly impressive time for us.
Yeah, thank you for mentioning that. And I had a follow-up for you, Olivera. We have some nonprofits, who are listening. We have some, donors and other, business leaders. I heard you say that collaboration was a huge part of your strategies for moving forward to advance early childhood in Houston. How can people engage in the work that you're leading and developing, and even this, child-friendly, city initiative that you just described? How can people plug in?
Absolutely. My office is really small, but we are very rich with partnerships and collaborations. There's a lot of ways people can get involved with our office, and specifically, since this is a webinar for the ARPA, I'd like to mention that even though cities don't have specific say on how this is spent, there's a lot of ways that communities can take advantage and advocate. I think the first and foremost is to be aware of the some key aspects that these funds provide. And I'll just go through real quick, just to mention them because it's important. I know Rob allowed a good overview of the ARPA funds in general, but let's not forget that we have the elementary and secondary school emergency relief fund. This is for, for schools to get access to community-based summer learning and after-school programs. Well, my office actually is the leader on a program called Out to Learn in Houston, and we collaborate with over 180 community organizations, institutions, libraries, to create a database for those extracurricular activities that are low cost or no cost. We also have the emergency assistance to non-public schools, which is about $2.75 billion in relief to private schools and daycares. We have the higher education emergency relief fund, and this is for campuses and college campuses. So for all the nonprofit leaders who are listening on this call, how can we make all these educational initiatives, well known out there in the community so that educational institutions can know about it? But the most important one, I think, and my office does a lot of work on this, is the E-rate Emergency Connectivity Fund. I'd like to share a very quick story. I went to a school, I'm not going to name specifically, but the principal mentioned that 34% of the students have received an incomplete grade, compared to 9% in one class, compared to 9% the prior year before the virtual environment. Now, as a policymaker, one might think that the data suggests that virtual environment doesn't work. But if you dig a little deeper, and if you actually ask the right questions, I was able to find out that the students received an incomplete grade because the school had a requirement for on camera for classes. Now that really ties back into this particular benefit. Can we help students who might have been affected in situations like this? I mean, what really tells us that these students had either access to good internet or even a broadband, internet strength for them to be participating in a camera. So again, these are some of the things that we just have to know, and as a community leaders, to help those who do have access to the funds to understand that they can take advantage of this. We even did a survey, and 14% of nearly 200,000 plus students lacked at-home internet. So that's a staggering figure, and this is only 27% of the families responding to this survey. So again, my office does a lot of work on kind of the digital equity, the digital divide, and we're trying to put everyone together in one big giant collaborative to help us, raise awareness of these funds, as well as to, help us find the most impactful places to use them. And then, of course, there is a food assistance, and I think that's the most familiar one. Everyone knows that there is availability for school, out of school lunches for children. So just really in closing, support can be different for different people, but for my office, I think the most important thing is to raise your voice, to be able to participate either through the Child Friendly Cities Initiative. Dr. Moore is one of our leadership task force member, and we thank her for that. But supporting legislation, advocating for local school districts to effectively utilize the ARPA funds, and to make sure that the most disadvantaged students are connecting, and they're collaborating with local businesses to help the need with education and the workforce. So I'll stop there for a second.
Well, thank you. And thank you to all of our panelists and for participating today. I sincerely appreciate your time and your insights. I'm really hoping that in addition to the audience who is live with us today, that other folks will have an opportunity to hear and learn from your experiences, as well as then take this information and advocate with their local policy leaders, and even engaging philanthropy and conversations about how do we partner and strategize to have a path forward. Are there any remaining comments or things that any of the panelists would like to address before we close?
Glad to be part of the conversation. It was great.
Yeah, thank you. Thank you so much. Okay, well, it is 1 o'clock, and so we will let everyone go. I see that Olivera put her email address there, so feel free to contact the mayor's office with questions or thoughts or collaboration opportunities. And again, you can find Robin Art's publications online, and to learn more about the Minnesota model. So again, thank you all for your time, your attention, and I hope that we can continue this important conversation.